So our next speaker is Emma. So she's from Crew. Crew are a national harm reduction charity established in 1992 by a group of community activists and peer educators. Their mission is to reduce drug and sexual health related harms and stigma, improving mental and physical health without judgment. So I'll hand over to Emma, though we do have slides as well, Leo.
It's okay.
Thank you. Great, thank you so much. Thank you. So really lovely to be here. Thank you very much for inviting me along. And it's always a real pleasure to speak alongside Peter. Thank you so much for what you've done for everybody in Scotland. And I think it's always really important to remember that just because the status quo is as it is, it's really, really important to remember people like Peter and to remember the possibility of change. So as Caitlin was saying, Crew 2000 Scotland is a charity now. It was actually started as a collective by these young people who were young people on the dance scene in Edinburgh in the late 80s, early 90s. If you're ages with me, you'll probably remember that time. There was a huge moral panic at that time around the acid house phenomenon, free unlicensed parties that were going on, and the moral panic seemed to focus on ecstasy or MDMA, which was a drug that was very popular and sought after in those days, but actually quite hard to get hold of. So although MDMA was definitely something that was publicized as part of the scene, quite a lot of people would have been taking all sorts of pills. As Peter says, they wouldn't have known what on earth was in them. Also, I think one of the most significant features of that time was that young people in their thousands stopped drinking alcohol because they were going to these parties. And in those days, if you're a real sort of connoisseur of the dance scene and a connoisseur of MDMA, you wouldn't want to spoil your experience by having alcohol with it, which is still a harm reduction message that we give to people today. Mixing any two drugs is going to increase risk. But I think it highlights a point that Peter made really well, that certain drugs are vilified and criminalized, and it isn't always about the amount of harm they cause. It's very often a social justice issue, and it's very often around who's using them and in what context. The drinks industry, as a response to this dance scene, actually employed thousands more young graduates to try and entice young people back into using alcohol as a result of this huge change in people's behaviour. So again, I think it's really important that we keep that social justice focus. So Crew now is an organisation working across Scotland, sometimes in Europe, and 30% of the people who use our website are actually in America, seeking harm reduction, education and information that is very difficult to access or publicise in America. We've always seen drugs as a social justice issue and as a health issue. And it's interesting that, you know, almost 30 years later, the Scottish Government is recognising the importance of putting drugs within the health structures of Scottish Government rather than in the criminal justice structures, but I do think we still have an awful long way to go. So if we go on to the next slide, I'll just quickly explain a little bit more about how we work at Crew. Thank you so much. So we have a step care model so that anybody can come and see us at any stage. They don't have to be in serious trouble to come and see us. If anybody's a little bit worried about one of their friends, if they're a little bit worried about themselves, if they're planning to try something and they want to find out what the risks are, they can come and have a really informal chat with us at our drop-in on Cockburn Street in the centre of Edinburgh. We were very fortunate to get this beautiful building in the centre of the old town. It's really important to us that we're near public transport links and we're not in any particular territory that young people might see as not belonging to them. So we're in the city centre. We're open every day except Sunday. And anybody can come and ask us for help. And the range of queries that we get in our drop-in will range from someone coming in to get condoms and STI protection, to a parent coming in because they're at their wits' end, they don't know what to do, their young person is taking drugs and they're really, really worried about them. And the day after we actually started giving out naloxone to people to take away to reverse drug overdoses, people who are using opiates, someone did actually come into the drop-in starting to OD, and we were able to bring them around because we had the naloxone and we had everybody, all the volunteers and staff trained in using it. So it's a huge range of people that we work with. And as Peter says, it's not a medical model. It's deliberately very, very, very low threshold so that anybody can come and see us without feeling that they're risking anything. We protect the confidentiality and we'll support them however they want to be supported. So the next step we offer is more in-depth support, harm reduction for people who are using drugs, risk education for those who are thinking about it, and then welfare provision at festivals across Scotland. We can work with the people who don't need to go to see the paramedics or don't need to go and see them, the medics, but who are probably not having a great time, but just need to sit with somebody to keep calm, to get hydrated, and to find out how they can stay safer next time. We also offer telephone support and advice, and we have a self-assessment tool on our website as well that anybody can use anonymously to have a look at how dangerous their drug use might actually be. We're the only counselling service and treatment service in Scotland for people using stimulant drugs. We've been doing this since the mid-90s. Again, that counselling service is now completely professionalised. All our counsellors have got 7 years plus of training working with people, some of whom are in a very, very vulnerable position. But it's very, very important that we think about changing the way the treatment system is oriented completely towards opiates at the moment, because as Peter says, we have a huge problem with benzodiazepines and other drugs that are popping up in supply. We've also seen a huge increase in deaths and harm from cocaine in Scotland. If you told me in 1992 that people who are homeless were using cocaine, I just wouldn't have believed you. It was way too expensive and it didn't produce the kind of effects that we would expect homeless people would be looking for, but that is something that's relatively common among homeless people these days. So one of the biggest changes we need to have is that we equip people in drug services to work with people according to the drugs they're taking, according to the needs they have. We also offer recovery support for people after counselling and after they come out of programmes like LEAP, which is Edinburgh's residential rehab programme. But again, anybody can come and see us at any point in time. There's no high bar for people to get over to come and see us. And on to the next slide, that's just illustrating the different kinds of work that we do a little bit more. I won't chant through that, but there is a free text service as well. So a lot of young people don't have enough data to be phoning helplines, but they can text us for free and then we'll call them back with any support that they want. On to the next slide if we can. Again, I won't read through this because I think Peter illustrated the situation that we're in at the moment really, really well. But I think, again, looking at the reason we need to look at drugs as a social justice issue, the people who are far, far more likely to come to harm from drugs are those who are already experiencing inequality. There's a huge, huge discrepancy between somebody with privilege and money and protection and those people who have none of those things. Also, the prevalence of polydrug use, using more than one drug, is something that is increasingly common. And again, mixing any two drugs is always going to increase the risk. And again, there's that huge percentage increase since 2008 of deaths from cocaine. I think it's also important to highlight that those 1,330 people are only the people who actually died from controlled drugs and who died from toxicity. There are many, many other people as well who died from misadventure or other injuries associated with drug use that will not get shown up in the statistics. So it's really, really clear that we need to change. Also, because drugs keep getting banned, this feeds a drugs market that is incredibly dynamic, has got no regulation whatsoever. So it moves really, really quickly. And certain drugs, cocaine is the best example, I think, are stronger, cheaper, and much more widely available than previously. You don't have to go to a sort of dodgy person in a weird flat anymore to buy drugs. You can get them delivered. You can get them online. If we could go on to the next slide, if that's okay. So again, just emphasizing the social determinants of health there. I really like this quotation from Sir Harry Burns because it just clarifies the fact that, say, for example, I'm miserable, I can go to the gym, I'm lucky enough to be able to afford a membership, I'm lucky enough to have a house that's secure and safe and comfortable. I can find solace and I can meet my needs like that because I have privilege. And then if anybody has time to read the article from Maya Svalovitz in the New York Times, looking at why people use drugs, I would really, really recommend it. If we could go on to the next slide, if that's okay. The other thing I think is really important for us to think about in drug policy is there's a recognition of adverse childhood experiences and the influence they have on young people's opportunities and chances and health outcomes. But we also need to think more widely and systemically about the adverse childhood environments that also affect their chances and their happiness and their health. It's not just about the bad things that happen in a family because of individuals, it's about the structures that people find themselves in. It's about poor quality housing, it's about the lack of opportunity and the lack of mobility, and it's about discrimination and community disruption as well, and the discrepancy again between the privileged and how much surveillance and interruption in their communities happens and how much happens if you happen to live in an area of significant deprivation is extreme. If we could go on to the next one, please. So in terms of data in Scotland, we have got some data that is collected in schools by the Scottish Adolescent Schools and Lifestyle Survey. There's a general downward trend in terms of the drugs that young people, the frequency that young people report in terms of drugs. But alarmingly, from 2016 up to 2020, we saw a really sharp increase in the number of young people dying from drug-related death. Thankfully, in 2021, the most recent year for which we have statistics, the number was less in that year, and hopefully that will continue. But we have significant concerns about young people in areas of real inequality starting to use heroin again, which is not something that was prevalent previously. In this context, we also have to be very conscious of the fact that waiting lists in young people's substance use services, where these actually exist, are long. And in child and adolescent mental health services, they're longer still, sometimes up to 18 months. If you have a mental health problem as a young person, 18 months later, you're a different person and your problem's going to be different. So it's really important we recognise that. And this is somewhere where things definitely have to change. There are also increased, as I said, availability and strength of drugs and decreased costs. I think one of the most striking things at our first festival of the season this year was that we spoke to young people who said they were already speaking to their GP about drug taking. This is not something we've ever encountered before. Generally, the crowds at a festival, they might be using drugs quite heavily, but they wouldn't be seeking help before. Now we're speaking to lots and lots of young people who are. So we have to be careful in the future about that generation and making sure that we have support for them now before things get too entrenched. If we could go on to the next slide, is that okay? So very quickly, I want to challenge the SALSA survey, and I think that's a real challenge for us in Scotland, is to get better data on prevalence of drug use among young people. The SALSA survey, schools don't have to do it, they can choose to do it or not. They can also choose which groups of children get to actually do the survey. So this will be a survey that only includes people who actually attend school, and we do know that the biggest risk factors for coming to harm from drugs are things like not attending school, not being supervised by parents outside school times. And also we only get the data from those students who are actually able to and willing to sit down and write about drugs and other really sensitive topics in a school in exam conditions for 45 minutes. So it's not a good representation of the people we really need to be supporting better. If we could go on to the next one. Okay, so we have a national mission in Scotland. There was a huge push to increase residential rehab. There was funding for grassroots groups. There was a recognition of the absolute importance of listening to people's lived and living experience in terms of how we set up and formulate services. There is work ongoing on setting up an overdose prevention centre within the NHS, but as Peter said, this is within a very strictly medical model, and it has taken years for this to happen. Saket Priyadashi, who put this together, has had the evidence, the budget, the building, the plans, the personnel ready for a number of years now, but it has taken so long to get this underway. And the argument given is the Misuse of Drugs Act, but obviously we have centres already who are giving out injecting equipment to people who may have drugs on them. And the police recognise that they shouldn't be intervening and arresting those people when they access safer injecting equipment. So there really is no reason why that can't go ahead sooner than it has done. It's really unfortunate, but the good news is that that will be happening within the next year. We are also part of the advisory board of a group setting up drug checking projects in Glasgow, Aberdeen and Dundee. Most importantly, these will be in communities. I think people may have seen the work of The Loop, who are a wonderful organisation at festivals. That work is really important, and we would love to work with them in the future to bring that to festivals in Scotland. But again, the most harm is happening in communities affected by deprivation and inequality, and that is where we need to have checking and testing so people can actually find out what is in the supply. We also have discretionary powers of arrest in Scotland, which means that the police are not obliged to always make an arrest if they find somebody in possession of drugs. But again, discretionary is the key word here. There's no real metric or guidance to stop people's inherent bias in terms of who they stop and who they charge with possession. And we know that this will fall onto working class young people experiencing inequality more than it will fall onto middle class young people. So just looking at government responses from the UK, we had the Scottish Affairs Select Committee in 2019 outlining drug deaths in Scotland as a public health emergency, quite rightly. It called for reform of the Misuse of Drugs Act, and it called an investment in treatment, including overdose prevention facilities, and it called for decriminalisation of possession for personal use, as well as addressing stigma. There was then an independent review of drugs by Dame Carol Black in 2020, which was pretty damning, but it's generally respected as a review in terms of not pulling any punches, of being really real about the problems that we face. The response to that from the current government, from Harm to Hope in 2021, is disappointing. There was enough money attached to it, I think, to satisfy some of the bigger players in terms of drug treatment, not to reject it out of hand. But unfortunately, it's an extremely punitive, judgmental policy that doesn't really change the status quo. So again, I think, as well as what happens in Scotland, we need to be really mindful about how can we influence change in the UK as a whole. There was a drug dress summit in Glasgow in 2019, where there was actually a setup of an overdose prevention facility. Kit Malthouse did actually come, but he refused to go and be pictured next to it. But that felt like some progress, whereas now the Home Office is actually snapping back on Home Office licenses for research into drugs for treatment purposes and for checking purposes. So it's really concerning that there seems to be this regressive tendency within government at the moment. And again, investment, as always, is always focused on the front line. It's always focused on treatment. And I understand the importance of that because people are losing their lives. But if we don't invest upstream, we're never going to solve this problem. If we don't address the inequality that drives drug-related death, nothing is ever going to change. Have we got time to go into the next few slides?
One last one, but I've got to be cruel and only give you one more, if that's all right.
Okie doke. So we'll come back to this one. I think quickly, there is a very uneven distribution of young people's drug services. We need to increase the emphasis on the needs of young people and also working upstream in our national mission in Scotland. And we also need to think more broadly about the detrimental impact of carceral approaches. For example, stop and search is supported in law and reinforced recently in law, despite very, very clear evidence that it is used in a very, very discriminatory way. So thank you very much. And I'm very, very happy for this presentation to be shared afterwards if anybody wants to see it or for any questions that we